Ever wondered why there are so many myths and misconceptions about breastfeeding? It's a fascinating question, and one that we're going to dive right into. Firstly, let's address the idea that there's a correct breastfeeding schedule. This is one of the most common misconceptions out there. The truth is, every baby is unique, and so are their feeding needs. Some babies may need to be fed more frequently, while others may need less. It's important to remember that there's no one-size-fits-all schedule. Instead, it's all about learning and adapting to your baby's hunger cues. Now, let's talk about another myth: the notion that breastfeeding is supposed to hurt. While it's true that some discomfort can be expected, especially in the early days, persistent pain is not normal. If you're experiencing pain during breastfeeding, it's crucial to seek advice from a healthcare professional. It could be a sign of a poor latch or other issues that need to be addressed. Another common belief is that if a baby is feeding frequently, it means they're not getting enough milk. However, this is not necessarily true. Breast milk is easily digested, and hence, babies often need to feed frequently. It doesn't automatically signal a problem with your milk supply. And lastly, there's the misconception that breastfeeding mothers should avoid certain foods. While it's true that some foods might affect your baby, most mothers can eat a balanced diet without any problems. It's recommended to maintain a healthy diet, but there's no need to overly restrict what you eat. These are just a few of the myths that surround breastfeeding. It's crucial to remember that every breastfeeding journey is unique. There's no right or wrong way to do it. It's all about what works best for you and your baby. Now that we've debunked some common myths, let's delve into the science and benefits of breastfeeding. Why is breastfeeding often hailed as the liquid gold for newborns? Let's delve into the fascinating science of breastfeeding to find out. Breast milk is a dynamic source of nutrition, altering its composition in response to the baby's growing needs. It's a symphony of proteins, fats, vitamins, and carbohydrates, all designed to fuel growth and development. But what truly sets breast milk apart is the presence of bioactive components like antibodies, enzymes, and stem cells. These elements provide a robust immune support, helping the baby fight off infections and diseases. In the early days after birth, the mother produces a thick yellowish milk known as colostrum. This is often referred to as the baby's first vaccine, packed with high concentrations of immune-boosting antibodies. As days progress, the milk gradually transitions to mature milk, which is lighter but still nutrient-dense, helping your baby thrive. Breastfeeding doesn't just benefit the baby, it's also a boon for mothers. It aids in faster recovery post-childbirth by promoting uterine contraction, thereby reducing postpartum bleeding. Breastfeeding mothers are also shown to have a lower risk of developing certain cancers, like breast and ovarian cancer. Furthermore, it fosters a unique bond between mother and child, boosting maternal mental health by reducing stress and anxiety levels. Interestingly, breastfeeding also plays a role in the baby's digestion. The proteins in breast milk are easier to digest than those found in formula milk. Moreover, it contains prebiotics that promote the growth of healthy gut bacteria, setting the stage for optimal digestion and absorption of nutrients. There's a reason why the World Health Organization recommends exclusive breastfeeding for the first 6 months of life. The benefits are immeasurable, extending beyond just nutrition. It's a beautifully designed system that supports the health and well-being of both mother and child. Clearly, breastfeeding provides a myriad of health benefits. But how do you do it correctly? Breastfeeding is a natural process, but it doesn't always come naturally. So, how can you ensure a good latch? Well, the answer lies in understanding the mechanics of breastfeeding and mastering a few simple techniques. The first thing to know is that a good latch is the cornerstone of successful breastfeeding. This is how your baby connects with your breast. A good latch means less discomfort for you and more nourishment for your baby. So how do you achieve this? It's all about positioning. There are several breastfeeding positions you can try. The cradle hold, where you cradle your baby in your arm with their head resting in the crook of your elbow, is a classic. But there's also the football hold, where your baby is tucked under your arm like a football, and the side-lying position, which can be a lifesaver for those nighttime feeds. Experiment with these positions to find what works best for you and your baby. Now, when it comes to a good latch, here's what you should look for. Your baby's mouth should be wide open, their lips flanged outward like a fish, their chin touching your breast, and their nose free. You should be able to hear and see them swallowing. If breastfeeding is painful or your nipples are sore, it's a sign that your baby may not be latching properly. But what if your baby isn't latching properly? Don't fret. It's a common issue that many mothers face. You can try adjusting your position, encouraging your baby to open their mouth wider, or gently detaching and reattaching until you get it right. If you're still struggling, don't hesitate to seek help from a lactation consultant or your healthcare provider. They can provide invaluable guidance and support. Now, let's briefly touch upon the topic of expressing and storing breast milk. This can be a great option if you're returning to work, need a break, or are having trouble with latching. When expressing, you can use a breast pump or your hand to squeeze milk from your breast. Store the milk in clean containers, and it can be refrigerated or frozen for later use. Just remember to gently warm it up before feeding, and never microwave it, as this can create hot spots that could burn your baby's mouth. Mastering these techniques can make breastfeeding a more comfortable and rewarding experience. But what if you encounter challenges along the way? Breastfeeding can present its own set of challenges. So what can you do to overcome them? Let's start by addressing one of the most common issues: sore nipples. This discomfort can often be traced back to improper latching. To mitigate this, ensure that your baby has a good latch. This means that your little one should have more than just the nipple in their mouth. They should be latched onto the areola, the darker area around the nipple. Using nipple creams or a warm compress can also provide relief. Moving on, let's talk about engorgement, which is when your breasts feel hard and painful due to the accumulation of milk. To alleviate this, you can try expressing a small amount of milk before your baby feeds to soften the breast, making it easier for them to latch on. Cold compresses between feedings can also help reduce swelling. Now, you might also face the challenge of low milk supply. This can be caused by various factors, including stress, lack of sleep, or not feeding often enough. To boost your milk supply, try to feed your baby or pump regularly, even during the night. Hydrate and eat nutritiously, as your body needs fuel to produce milk. Certain foods like oats, fennel, and fenugreek are believed to aid in increasing milk supply. Remember, these are just general tips. Every mother's body is different, and what works for one may not work for another. That's why it's crucial to seek help from healthcare professionals when needed. Lactation consultants, pediatricians, and even support groups can provide valuable advice and reassurance. Lastly, don't put too much pressure on yourself. It's okay to feel overwhelmed. It's okay to need help. Breastfeeding is a journey, and like all journeys, it has its highs and lows. The key is to stay patient and keep trying. Your effort is the greatest gift to your baby. Remember, every breastfeeding journey is unique. It's okay to ask for help and take things at your own pace. We've covered a lot today. Let's summarize the key points. We started off by debunking the myths surrounding breastfeeding, shedding light on the realities versus the misconceptions. We learned that every mother's experience is unique, and there's no one-size-fits-all approach. Next, we dove into the science and benefits of breastfeeding, discussing how it's not just a source of nutrition, but a way to bond with your baby. We explored how it boosts immunity, aids in development, and even benefits the mother's health. Then, we moved on to techniques. We learned about different positions, latch methods, and how to know if your baby is getting enough milk. All vital tools in your breastfeeding toolkit. We also addressed the challenges. From soreness to low supply, we looked at practical solutions and where to find support. Breastfeeding is a journey filled with highs and lows. But remember, you're doing a fantastic job providing the best for your baby. Keep going.